This is the procedure for ear irrigation. Okay, we're going to need much of the same materials that I described for the eye irrigation. Got your gloves, I have a drape, I have my irrigating solution, whatever doctor ordered, and in this case it's going to be normal saline. I have some kind of catch basin that I'm going to use to catch the irrigating solution. I have a bulb irrigation tray set. The only thing extra that I have added to this skill from the eye irrigation is I'm going to need the otoscope. Okay, along with a specula that goes on the otoscope, so I can look into the patient's ear before I actually irrigate to make sure the tympanic membrane is intact. And again, I'm going to just be on the safe side and bring in some sterile gauze with me and or some sterile cotton balls in case I need to clean the outer canal before I irrigate. Okay, so I've done going into my patient's room, I've done my DeWipes, checked my doctor's orders, checked for any allergies, done by identification, explained the procedure, provided for privacy, and I'm going to provide for safety for the patient and both myself. Hello, I'm here to irrigate your ear today. We're going to irrigate the right ear, and what I'm going to do is raise the bed to make it at my working height to keep my back safe. I'm going to go ahead and put the side roll down. Okay, bring my tray table over as close as possible. The first thing I'm going to do is assess the outer ear. As I said, if there was any drainage, what you could do is wet a sterile cotton ball with some saline and just clean the outer canal before you irrigate it. I definitely want to take the otoscope and I want to make sure I look into the ear canal and observe and make sure that the tympanic membrane is indeed intact, and it is. I'm going to go ahead and open up my irrigation tray. Okay. And I'm going to go ahead, and this is a used bottle of sodium chloride, so I'm going to make sure that it's been dated, timed, and initialed by the person who opened it prior to me. When I open it, I'm going to lip it. I'm going to pour the solution into my container, take the tip off the end of my bulb syringe. I'm going to go ahead and drape my patient's right shoulder and maybe put the head of the bed just a little bit. I'm actually going to have this person tip their head to the right because gravity is going to help that drainage return. And I'm going to probably have the patient hold the basin in a fashion that's going to collect the solution. Excuse me. If the outer canal, I'm going to make sure that I've assessed the outer canal. Throw out my irrigated solution. For the adult person, you want to take the ear, lobe of the ear, and pull it up and back. Okay. For children, it's different, but for the adult, it's up and back, and I'm just going to let the basin slide down for now. I'm going to take the tip. I'm not going to actually put it in the ear canal, but what I want to do is aim it so, well, I'm not going to put the tip directly down in, but I want to put it in and kind of angle it so my solution is going to be aimed more at the upper part of the canal as it goes in. Okay, it's not going to be aimed directly down against the tympanic membrane because we don't want to hurt that. So again, aim it up, not directly in the canal, but we're going to aim it in an upward fashion so the tip of the syringe is kind of pointed so the irrigated solution is going to hit the top of that ear canal, but not directly against the tympanic membrane. Okay, and I'm going to irrigate it as doctor ordered. Perhaps we're irrigating it to get wax out of it. Perhaps we're trying to get a foreign object out of it. I'm going to definitely note and see what kind of return I get. At this point, I can take a small wick of cotton. I can put a little cotton wick in the patient's ear and just have them lay on their right side and give it about 15 minutes for it to drain. Come back in about 15 minutes, you can take that cotton wick out and you can see more drainage and see if you did receive anything. Dry the ear and the outer canal and outer lobe. Make the patient comfortable. Put the side rail back up. At this point, we want to think about the assessment. We're documenting the assessment of the ear prior to the irrigation. We want to document how much we irrigated and with what solution, how the patient tolerated it, what kind of return we got, if there was anything in it, depending on our reasoning for irrigation itself, and assessment of the ear after the irrigation.